Hey everybody, it's Dr. Sam Robbins. Today I'm going to discuss how you can prevent, reduce, and even erase varicose veins. Now, a few years ago, maybe about 4, 5, or 6 years ago, on my right leg, I saw something I was hoping I would never see. There were small spider veins, which would have probably eventually turned into bigger varicose veins had I not taken the action to fix it, which I'll be discussing today in a few minutes. And basically, spider veins are a milder form of varicose veins. They're smaller and may eventually and typically will turn into bigger varicose veins. So why did this happen to me? Well, mainly because I'm getting older, but mostly due to my lame genetics. All right, both my parents have varicose veins. They don't have that many, but they do have them. And I'm bringing this topic up about varicose veins because, first of all, they don't look good, especially if you're a woman and you want to show off your legs, like wearing skirts, dresses and so forth. And they look worse if your skin is really white. Secondly, they are a sign of poor blood flow and pressure buildup, which can lead to venous insufficiency, thus reducing blood flow throughout your body and eventually, especially to your heart, which can lead to heart attacks or strokes in the future. So whether it's for vanity or longevity, varicose veins are not good. And today I'll quickly discuss the cause and different solutions so you can help prevent, reduce, and even erase varicose veins. And I'm going to tell you exactly what I did because the good news is that my spider vein has actually decreased and thus hasn't grown. Plus, I have nothing new growing or anything like that, so it's all going in a positive direction. Okay, so let's first discuss the cause of varicose veins. Now, the main cause of varicose veins is pressure and poor blood flow, which damages the vein walls and valves. Now, blood circulation to the heart is restricted and slowed down, and this can cause the blood to build up in certain places, and thus the veins grow larger, become distorted, resulting in varicose veins. Of course, genetics always plays a key role in everything, but other lifestyle factors can cause or trigger varicose veins, such as aging, sitting or standing for long periods of time, lifting heavy weights for many years, pregnancy is a big one, being overweight, an inflammatory diet, hypertension, high blood pressure, smoking, and also not exercising or moving much. Basically anything that causes pressure and restricts blood flow. So how can you tell if you have varicose veins? Well, the most obvious way to know if you have spider or varicose veins is just to look at your skin. Typically, they come out in your lower body, such as your legs and calves. Also, hemorrhoids are a type of varicose vein that develops in the rectum. Now, typical signs and symptoms of varicose veins include bulging and bluish veins, swelling, aching, pain, a feeling of heaviness in the legs and feet, itching, change in skin color, and also nighttime leg cramps. So let's talk about preventing and improving them. Let's say you have a family history like I do, and you want to prevent varicose veins, or maybe you have a couple of them and you want to reduce it and also at the same time prevent future ones. What should you do? So let me share with you simple solutions that you can implement today that I also did, and it made big improvements. First, you want to exercise regularly. And honestly, the best form is just a brisk walk. All you need is about 10 or 15 minutes, 2 or 3 times daily. It's easy and can be done anywhere at any time. And this is one of the big changes that I started doing myself. I do 10, 15 minutes before or after, 2 or 3 of my meals. Next, you want to elevate your legs whenever possible. Now, this is hard to do, right? You can't do it all the time, but, maybe take little mini breaks throughout the day for a few minutes and just, put up your feet and relax a little bit. What I do is I actually put a small pillow underneath my calves or knees in bed while sleeping. So my legs, are basically elevated all night long. And this is also really good for my lower back and my 2 herniated discs. Next, you want to move every 30 to 60 minutes. You don't want to sit or stand for long periods. I suggest every 30 to 60 minutes, just go move around. Walk up some stairs, or maybe just do like 10 or 20 body weight squats. Just basically move around and just get some blood flow going. Now, this was another change I had to make. I just sit for like 2 or 3 hours at a time working on a specific project. Now I just literally get up every 30 to 45 minutes or so. I walk around, maybe I go outside for a few minutes. I always go get a
Thanks for
glass
listening
of water
and have a
hydrate.
happy and healthy day.
Don't cross your legs. When you sit, don't cross them. Now, this is easy for most men, but not always possible for women. Just keep that in mind. You also want to wear compression stockings or socks on your lower legs. It helps. Losing weight is very important. Being overweight puts pressure on your entire body. Basically want to improve blood flow and circulation. And there are specific vitamins and minerals and amino acids that are proven to improve your circulation, thus reducing the size and severity of the varicose veins. And there's more information about the list of the best, vitamins and supplements for this. The list is below this video in the description area. Now, this was a big change that I made. I started taking a product called Blood Flow Optimizer. This is actually something my parents had been taking for over 10 years with great results, but I hadn't. So about 5 years ago when this started, I started taking it. And the good news is within the first bottle, I noticed improvements. I noticed better pumps at the gym, erections, also mental clarity. There's also medical things you can do, right? Surgery, laser, other medical options to remove varicose veins. This is especially important if you have a lot of varicose veins, especially the larger ones. One of them is sclerotherapy. Basically, this destroys, the varicose veins by injecting them with a solution called sclerosant. Now, the sclerosant scars the veins and causes it to collapse, forcing blood to reroute to healthier veins in a different direction. So then your body will eventually destroy these, varicose veins, and they will disappear over time. Now, this type of procedure is typically used to treat smaller varicose veins located close to the surface of the skin, the spider veins, and this will help improve the appearance of the legs. Also, there's radio frequency and laser ablation. Now, your doctor will basically numb the veins and use either radio frequency or laser to kill the veins. And this takes a few weeks or months before the results are seen, and this is done for the bigger veins. However, even if you do any of these medical procedures, because of your genetics and because of aging, new varicose veins will continue to come up as you age. So again, let's go back to improving your lifestyle and utilizing the simple prevention tips that I just mentioned a few minutes ago to help avoid future spider and varicose veins, to reduce them like I did. And again, for more details about this topic, make sure you visit the special page link below this video and the description area. Thanks for listening and have a happy and healthy day.